This is her baby, and she is so excited to share all of this information with you today about the program specifics, careers, and how to apply. And we're also joined by Jeannie Wakamatsu, who also works very closely with the program. If you guys have any questions, please hold them to the end. We'll have a Q&A section, and we also give you all a program description so that you can follow along as well. If you guys have any questions on your way home, feel free to reach out to either myself, Sarah, or Jasmine, or the other admission counselor you've been speaking with. We're more than happy to follow up with you. Karen.
All right, let us move along. All right, so I have been here for close to 10 years now with started with the coordinated program that we're talking about today, but we've added some new programs, and I have a joint appointment here, also over Keck School of Medicine. I worked at Children's Hospital and really spent more of my career working in the field of developmental disabilities and with kids. So I've kind of done full circle. I've done all age groups by the time I finally reach my retirement. Jeannie, that Stephen introduced, we are attached at the hip sometimes. Jeannie and I, we have, she's a year behind me in terms of working on this program. She is in charge of everything internship, and we have 400 preceptors that we work with now. We, over the years, have really expanded the number of people that Jeannie works with in the area of internship, and we will team tag in terms of talking with you today. So what is gerontology? I start with that. We are housed in the School of Gerontology, and being naive, when I first moved into this area, I always thought that gerontology meant just old people. And I didn't realize that it really truly is the study of the aging process. So in our program, and many faculty here in the school are not just looking at older adults, we look at the process of aging. And what better field than nutrition to look at the role of nutrition throughout the entire life cycle. So we look at all aspects: biology, psychology, sociology, and all of that related to the aging process. As a coordinated program, we have to cover many competencies that our accreditation body gives to us. So while we may be in the Leonard Davis School of Gerontology, we cover the lifespan. We cover all areas of nutrition practice. These are just a partial list of the undergraduate, graduate degree programs, and you can see the additional 3 that we have added. We now have a Master's of Science in Lifespan Nutrition Dietetics, which mirrors our coordinated program, doesn't have as many internship hours. Individuals aren't eligible to sit for the RD exam with that particular program. And there are individuals that don't want to go the route of a dietitian, but want many of the classes that we offer. The Master's of Science in Nutritional Science is for those that have finished an undergraduate dietetics program, or those that are working now as a dietitian and are looking for a master's degree. And then the last that we've added is a Master's of Arts in Food Service Management and Dietetics. And those individuals, we're preparing them to go into more of the food service side of nutrition. So those programs do exist, and many of the students are in classes together that are in those different programs. We have been accredited for, as I said, close to 10 years. We are needing to go through our accreditation process. In 2026 will be our next cycle. And we take up to 24 students on campus and or distance. We are set up for part-time 3-year, but only for our distance students do we offer a part-time 3-year. The other 2 programs, distance as well as campus, is a 2-year program. We don't require that you have an undergraduate degree in dietetics, which is called a DPD, didactic program in dietetics. but we do have prerequisites that are required. For individuals that have completed a DPD, we take that as meeting all of our prerequisites coming into the program, with the exception of the 40 hours of experience, paid or volunteer. And I'll talk more about the prerequisites that we require. Just this last year, we went through the approval process for STEM. And this is really critical for international students who will then be eligible for optional professional time, OPT, following graduation for up to 2 years. Once you apply and are accepted, you can stay in the US. You have to work at least a minimum of 20 hours in your field, but you can stay and work for a couple of years. So we're happy that that got approved. We require the 40 hours of experience prior to you applying to the program for 2 reasons. Reason number 1 is there is a competency that if we didn't require you to do 40 hours, you would have to take a 1-unit class that would be called Careers in Dietetics. And we don't want to add any more units to the 44 units that we already require. So that's one. The second is we want our applicants to know what dietitians do, what jobs in the field of dietetics look like. And so it serves a purpose of that. If you want more information about the graduate school tuition application fees, that information is available. And Stephen and Sarah can be contacted for that information. We require that you enroll in one of those 3 tracks. So full-time on campus, full-time distance, part-time distance. And for our distance student, our kind of loose rule is that you must be at least 100 miles from USC. I'm thinking of Irvine, with you living in Irvine. That one we're on the fence. Here's the challenge with you being in Irvine as an example. And Jeannie may talk about this. Southern California, including Orange County, all the way to San Diego, clinical internship sites are few and far between. With our distance students, we ask you to find your own internship sites. And in the rest of LA County, they're pretty darn limited. Even we have had challenges with finding enough clinical sites. That's our gap, is the clinical sites. So that we would definitely want to talk with you about, and are happy to talk with you about, you or anyone else that's listening to this. If you are thinking you want to do the distance, it really is going to come down to what might be available for you for internship. For the supervised practice, which is the same as internship, just a different word, Jeannie schedules that with you. And one of the things that we really pride ourselves on is that we are able to tailor internship opportunities to the student. And with over 400 preceptors, we've got a lot of flexibility doing that to really look at what is your interest. We have had students that have areas, I think I'm covering your stuff, I'm so sorry. We have had students that have asked, could they intern in a particular area that is not known to us? We're happy to work with you to see if we can set something up so that you can intern at that particular site. So our distance students need to set up their rotations. Again, we would help you with that. And we do have some, Jeannie has connections around, across the country, but not in every corner of the world. So, all right. I'm not going to go into great detail with the prerequisites. You are going to find prerequisites wherever you go in dietetics for a coordinated program, or even if you decide to go back and work on a DPD program. The third bullet that is listed there, cell biology, microbiology, general chemistry, etc., that is not unique to USC or to this program. You're going to find that wherever you go. And where we will work with you is you may take an organic chemistry, we prefer lab if it's offered. You may have an OChem class that doesn't have a lab. You may have an OChem class that's 3 units, but you had 5 or 6 units of biochemistry or physiology. So we will work with you. Please reach out and talk with us before just going out and signing up for more prereqs because you think you missed by 1 unit that you need to take a whole nother class. Please reach out to us so that we can look at what you've done and guide you in terms of what we will and won't accept. One of the challenges is if you're in a quarter system for whatever other degrees that you may have and transferring quarter units to semester units, they don't always work out exactly. Again, we will work with you on that. Prerequisite courses, many of them can't be more than 10 years old, except for psychology or sociology, speech communications, or math. And if you're cutting it pretty close to the 10 years, again, reach out to us. We have a template that is posted on our website that we ask you to complete. And we use that to talk with you. We use that when we bring our team together that does interviews to look at what courses you've taken, what grades you've received. So that actual Excel file gets uploaded in your application at the time that you apply. My first bullet was DPD. So if you have completed a bachelor's degree or a post-bac degree and have a DPD verification, you meet our prerequisites other than the 40 hours of volunteering or working in the field of nutrition dietetics. In terms of applicant selection, we meet in February, usually February. We have a team of individuals that work with us on interviews so that we're fair to all that we are interviewing. I think last year we probably interviewed 75% of the applicants. We interviewed quite a few of the applicants. Some applications aren't complete or individuals have too many prerequisites that they still need to complete. We might not ask them for an interview. We might suggest that they wait until the next year because they have too many prereqs that are still remaining. We will likely do interviews on Zoom. I don't know, we'll think about it. Maybe this year we'll go back to live interviews. We kind of got used to Zoom because of COVID. Interviews last about 20 minutes and we have a few questions that we asked. Everybody on the team is able to ask questions. We include faculty, we include graduates of our program, staff, and preceptors, individuals that are taking our students in internship. What we look at, we are a very science-heavy program in terms of nutrition science. You have the best instructors. Roberto Vignanza, who teaches macro and micronutrients. He is an MD geriatrician with a PhD in nutritional biochemistry and did a postdoc in nutrition at UCLA in David Heber's lab. He is overqualified in teaching macro micro and really is a delight, does an incredible job teaching. We have an MD general medicine doctor who teaches the lecture for our medical nutrition therapy class. Our course that is in Italy in your first summer is taught by one of our biology faculty who is going to teach you about the biology of aging with nutrition as the model. And that's Walter Longo. And biology is his gig. He will go deep into the biology, the biochemistry. So I don't say that to scare anyone away, just to let you know this is our program and it's what we feel is important and what we include and what we teach. I truly do believe that nutrition is a science. We are not dietitians in the kitchen. We are not dietary. Oh, you're from dietary from the kitchen. We are not dietary from the kitchen. We are nutrition scientists. And so we teach it that way. So we look at science grades. That's important. We also look at your letters of reference. We look at work experience, not just paid work experience, volunteer work experience. What skills do you have? What are things that you've done? And we look at skills that are not nutrition dietetics. We look at leadership management skills. We look at organization skills. Again, we're looking for people that will be successful in this very fast program. And we look at your personal statement. So, all right, turning it over to Jeannie.
Right. Welcome, everyone. I'm Jeannie Wakamatsu again. I'm the program manager and the internship coordinator. So I help manage the other nutrition programs, but in terms of internship or supervised practice, I do focus on the coordinated program. And just to let you know, there are only 2 coordinated programs in all of California. We're one of the 2, and we're the only coordinated program with a distance component. So we are very unique. In addition to that, you know, what makes USC so special, and which I'll get into in my next slide, is that we have our own health system with our own hospitals. So that makes it even more unique. So I'll get into that later. But before you decide on USC, I think it's important to be data driven. Like, why USC? What makes it special? And one of the things is that we do measure our program success. So we have an alumni data. So 1 year post-graduation, we do ask our alums to take a survey and let us know what they're doing and how they're doing. And so we have our program objectives and our results. So the first objective is that 80% of graduates will pass the CDR credentialing exam for dietitians within 1 year following first attempt. And we aggregated data for cohort 1 through cohort 7, sample size of 116, and 97% of our graduates passed the CDR exam within 1 year, which means that maybe some of them did pass in the second year, but we only count the first year. So this is why it's 97%. The second program objective is that 80% of graduates would complete the coordinated program within 150% of the allotted time frame. And then as of the last cohort who just graduated in May, 99% have graduated. So we have one cohort 8 student who is completing a part-time degree program. So this is why it's 99%, but it should really be close to 100. Our third program objective, this is for me very important. I don't only track whether you finish the program, but I want to make sure you get a job. That's the reason why we're all here. You want to be a specialist in the field of nutrition and dietetics because we need you to increase and to promote our profession in the future. So 75% of graduates will report employment in a dietetics related position within 12 months. Of completing our program. And I split this into different cohorts so you can see the progression. So first time around when we aggregated data for cohort 1 through 5, it was 93%. Then when we looked at cohort 6, it was 94%. In our recent survey, cohort 7 to cohort 8, it was 96%. The only reason why it was 96%, should be 100%, is that one graduate got a job in a non-dietetics related field, but it should be really 100%. So for us, we track your employment as well because this is really important. Okay. Oops, I think it skipped one. Supervised practice site. So here is our big unique factor is that we do have our own system. So we have 4 hospitals. We have Keck, Norris Cancer Center, Verdugo Hills, and Arcadia. All of our students are in all of these hospitals. In addition, we hired a full-time clinical preceptor. So most programs cannot maybe even afford or house a full-time clinical preceptor, but we have a clinical preceptor who is also a graduate of our program. So the wonderful thing about that is our clinical preceptor knows exactly what you're going through because they went through it. They also know all the assignments that you would need to complete. So we have someone on site to support you. And Dr. Kreitzer mentioned about being a clinician. We are not in just the food service. We're a clinician. We're part of the healthcare team. So remember that when you go into the hospital. So when we demand certain level of student competency, it's because we want you to be the best clinician possible, regardless of the field that you go into post-graduation. The foundation of medical nutrition therapy should be there. And we're offering you the best sites to learn. We also have LAG, which is LA General Hospital, which I think was formerly known as LAC USC. We have Kaiser, we have Glendale Memorial, and many more hospitals. We also have students intern at long-term care, skilled nursing facilities. And then here at USC, We have USC Hospitality, which includes our hotel, residential halls, and all of the dining facility. And I mean, that's a great food service experience that any student could wish for. And sports nutrition. As a D1 school, we have more sports dietitians than any other D1 schools I know of. We have 6. Okay, that's a lot. We have more sports dietitians than any other pro teams that I know of. And so if you're interested in performance nutrition or sports, this is the place to be. You will be trained by the best. And many of the sports RDs that are housed at USC, they go on to pro teams. So that is sort of the next step. And research labs. I mean, this is a Research One institution. You can reach out to any professor in any school. You can reach out to those in the School of Gerontology, but don't forget, you can go down the street to engineering, or you can go anywhere because you are a student of USC. We get requests from students from all over campus, from different disciplines, and we work with them. Okay. We also have USC Head Start program, public and private schools that we work with, community colleges, and nonprofit public health nutrition programs. Los Angeles, this is the house of nonprofit. And I have a public health background, so does Dr. Kreitzer. So if you are interested in public health nutrition, serving a mass population, serving the community, then this is the right place for you as well. And pro athletic teams. So we do have contracts with professional football teams, soccer team, hockey teams. So that's what you want. This is also the place for you. And private practice, disorder, eating, and substance abuse programs. Again, Dr. Kreitzer mentioned about your specialty. I try to work with you to give you the best experience there is. Now, there is certain barriers. I mean, I have students who come up to me and say, I want to work with Disney. That's great if I don't know anyone at Disney. So if you know someone, let me know. So you can, if you are proactive, go out and seek out your own RDs to work with. And I will help you do the contract and all of that to set that up for you. Okay. Oh, so USC Keck Fellowship. This is something new. So this is a partnership with the Sodexo and Keck, where they are extending the learning for new graduates in our program only, the only USC graduate students, to offer them fellowship, which you will be trained at the Keck Hospital for a year. You are paid. This is a paid position, and the pay is highly competitive. I looked at the range, and it's way more than even other hospitals. So you get to be trained by the best, you get paid with benefits, and you get to pick your preferences. And they will draft a schedule and specialize that learning experience for you. So this is something new, but it will be ongoing. So if you want to go into clinical nutrition, this is also the place for you. Here's a picture of 2 of our former students. They're graduates now. They're both RDs, Esmeralda and Karina, and they are our first fellows. So here they are, and that's the hospital that some of you will be at. Okay, so careers in nutrition dietetics. I get this question all the time. What do students do post-graduation? So I wanted to give you a snapshot of some of the jobs and careers that most of our graduates go into. So here pictured is Dr. Amy Lee Amos. She just finished her PhD. She's a founder of Amos Institute. She specializes in dementia. She works, this is her niche, and she's done very well for herself. She's a speaker at many, many conferences. So we're very proud of her. She was in our first cohort. We have Sherry, who is an outpatient dietitian at the Susan Samueli Center for Integrative Medicine. We have Whitney English. I don't know if you've ever heard of her. She's a media RD and a social media influencer. She also wrote her own book on plant-based baby and toddler.
She's Whitney E. or Whitney ERD on social media.
And she used to be the RDN for 24-hour fitness. So if you ever work out at 24-hour fitness and they have those little, she'll come out and do like a little, 1 minute, 60-second tip on nutrition and fitness. And then we have Erica, who's a sports dietitian for LA Galaxy Football Club and Herbalife. Amanda, who's an outpatient dietitian at West Palm Beach VA Hospital. So you can go into government. Ahad, who is a clinical dietitian in Dubai. So she was an international student. She went back and she's a dietitian in Dubai. Rochelle, who is a PhD student at UCLA. She's a pediatric clinical dietitian right now at UCLA Mattel Children's Hospital. So as you can see, there are a lot of different opportunities. And then Jordan is a corporate dietitian for a startup, Nutrition Tech. I just read on paper, like they got a huge investment from funders and they're starting this new nutrition tech company and she's part of that team. We also have Jillian, who's a sports dietitian for Anaheim Ducks Hockey Club. And then Christy Schuld, who's a sports dietitian here at USC. In fact, USC hired 2 of our graduates, not just Christy, but here pictured is Bianca Hollis, and she is also a sports RD. So if you are going through our program, pretty much you'll work with one or both of them at some point in time. Emma is also a PhD student. She is an owner of her own business. She's a private practice and she is a clinical dietitian and she's in Houston right now. Erica is a clinical dietitian at UCLA, Olive View Medical Center. Katie has her own private practice. She's doing very, very well and she's also a personal trainer. Stephanie Marr is a clinical dietitian at LAG. Alana just graduated. She is a public health dietitian at APLA Health. And Brittany, who just graduated, is working with the Eating Disorder Treatment Center. So you can see that you can graduate from here and go anywhere. It's up to you. And I just want to mention this because this is for just this year. Melanie Murphy, I nominated her. And I'm so grateful that they selected her as the Outstanding Young Dietitian for 2023. And she was acknowledged at CAND. This was
this past
April. And then Lauren Sutherland was selected as the Outstanding Dietetic Student in a Coordinated Program for 2023. This is the 4th time our student was a recipient of this very prestigious award. So I wanted to highlight that we do write recommendations for scholarships and awards. And many, many, many of our students every year are recipients of those scholarships and awards. Okay, all right, Dr. Kreitzer.
All right, I think I mentioned this list of faculty, a few of these members. I'll mention Socorro Carranza, who is working on her PhD at Loma Linda, and she teaches part-time for us. She is certified in diabetes education. And I mentioned Walter. Nick Padula, we just brought on as a part-time adjunct lecturer. He worked in nutrition in senior communities and brings that into the program. And many other speakers in classes, as much as we can give students a snapshot of what dietitians do in many different fields, we bring them into the classroom. I mentioned that there is one of the core classes is Gero 498, and it looks at the role of nutrition in the aging process. And Dr. Longo is in the picture on the left in the middle with the blue t-shirt and the Levi's. He teaches that class. One of the things that he has students do when they're in Italy is he partners with colleagues of his in Italy, and this group of students was able to see an OR procedure being done. So some students, not all students, but a number of students tell us that the class in Italy was probably their favorite of all the classes that they completed throughout the program. So in terms of just mentioning about changes at the Ascend, the accreditation level, the Accreditation Council for Nutrition Dietetics and Commission on Dietetics and Registration, we all voted to move the master's degree as entry level for dietetics practice. And it's been a long while coming, but it goes into effect January 1, 2024. Doesn't really change what we're doing because we've only had a graduate degree here in the years that we've been here. What it does mean is, and that was one of our reasons for starting up the MS in nutrition science, is that only about half of all practicing dietitians in the US have a master's degree. So we have a feeling we'll see people going back to school to get their master's, along with those that are now finishing up degrees will have to continue on and get the master's degree. So, you know, if things go a different way for you, if you're applying for an internship and you decide you want to come talk to us about the Masters of Science while you do your internship, we have a number of students currently in this MSNS that are enrolled in internship programs. And one of the areas that we can be really flexible about is how many classes you can take per semester. And we at the MSNS degree level, one class per semester is fine. USC will let you take a leave if you need to take a semester off because you're doing your internship. With this program, you can enroll online. You don't have to be 100 miles away. You can live in LA and decide to do the program online for this Masters of Science in Nutrition Science. So there's a lot of flexibility with that program. In terms of deadlines for applications, our deadline every year is January 15 for the fall start date. Any transcripts that you need to send in can be sent to Jim DeVera, and his information is there. I will say for your applications, and this is really important, if you are taking prerequisites and you still have 3 or 4 prerequisites still to go, we would look at you. Probably 4 is pushing it. Anything beyond 4, you need to have a conversation with us, because I don't want to not interview you if you have 5 prereqs as of the 1st of January and you've got a plan that you're going to get them done. You're not working, you're just doing prereqs. We would consider you. But if all we've got is a piece of paper with what you have left to take, you may not be asked in for an interview. We have had people in the past that we've interviewed, we've accepted, that haven't been able to complete their prereqs in time, and we've had to push them to the next year. It has to be done by the day that we start. So if the start of the fall semester is August 24th, your prereq must be completed by the 23rd of August in order to start on August 24. So make sure that you're letting us know what you have planned. I like to see that you have a plan. If you have just a blank on your prereqs for biochem, OChem, and food science, you didn't say where you think you're going to go. That worries me too. So have a plan for your prereqs in terms of where you're going to go and when you think you'll be taking that prereq. So that's important. Similarly, your 40 hours volunteering with a dietitian, we want to at least see a plan. If you're having a hard time getting hooked up and you've started, it's December and it's the holidays and you've already done 10 hours with the dietitian that you're going to be working with, fill that out, write down what you're doing, upload it with your application so that we see that. We see that you have a plan, you have a person, you've already started, and here's your plan to finish that up. So we will not require you by January 15 to have completed all of your 40 hours or all of your prerequisites. And if you're close, and it would be better to apply for this year versus wait a whole nother year, I would say try to finish things up and apply this year. Yeah. Anything else I missed? Okay. So for the other 3 programs, the MSNS, the LND, and the MA, we take applications. We allow enrollment in the fall or the spring. With our coordinated program, we only do fall applications and fall start dates. So for those other degrees, we have different application dates because of those being different programs. Additional information, Sarah Robinson's contact is on there. My contact is on there. We have a lot of information on our website. I encourage you to look at the website. You've been given some materials when you came in today. That's also on the website. This recording that we're doing today will also be uploaded on the website. If you want to go back to it later and review the things that we covered. For anybody that's watching this recording, please reach out to us. We're happy to answer any questions that you have.